Hello and welcome. It's 11 a.m. here in Seoul. I'm Lee Kyung-eun at Arirang News Center. We're breaking into our regular session to bring you a live briefing on the South Korean health authorities on the COVID-19 outbreak. In just a few moments, we'll cut into the briefing at the Sejong Government Complex with simultaneous interpretation in English. Health Ministry official Yoon Tae-ho will be giving us the details on the COVID-19 situation here in the country. He'll fill us on the number of new infections as of midnight and the efforts that the government is making to contain the virus, especially with the increase in cluster infections in Seoul and the surrounding capital region. To give you a brief idea as we wait, South Korea reported 686 new cases of COVID-19 on Wednesday. That is the highest figure since the peak of the country since the first wave in early March. Let's cut into the briefing. Take a listen.
Let us now begin our regular briefing for December 9th, Wednesday. As of today midnight, we have a total of 662 new local infections, and in the metropolitan area we have 524 cases and 138 reported in the non-metropolitan region. And we had 4 additional fatalities. I extend my deepest condolences to the deceased and the members of the bereaved families. The local cases, and today we see 662 new local infections, and this is actually the third highest number of daily cases since we have the first outbreak here in South Korea. And we have the 79% of the total cases being clustered in the metropolitan area, including Seoul City, Incheon, and Gyeonggi-do Province. And looking at Seoul alone, it is the largest number of daily cases. And during our third major wave of South Korea, we are seeing rapid spread of the COVID-19 virus in the metropolitan area. Up until now, the effects of social distancing measures have been showed and have been unveiling in limited aspects, and we believe that there are many cluster infections and possible cluster infections in the metropolitan area. And we have a high danger and high risk of infection in the metropolitan area, and to this end, all of the residents in the metropolitan area are advised to refrain from having social activities and also minimize a physical contact. And also remember that you can get exposed to the virus at any place, at any time, and please wear your face mask at all times and minimize your contact with others. Starting from yesterday in the metropolitan area, we have elevated the social distancing measure to level 2.5 and level 2 for other regions in the non-metropolitan regions as well. And in order to have full achievements of these toughened measures, it is very important for the government to have toughened measures. And on top of that, we need the public's voluntary support. Last weekend, looking at the mobile traffic in the metropolitan area, compared to the adjustment of the social distancing measure, we have seen 22% drop. However, compared to the immediate week before, we have seen an increase by 0.6%. So we ask you to stay vigilant going forward. And as for the risks and as for the measures that have toughened surveillance, and including the shutdown of the services and facilities, are only carried out at certain and limited aspects. And there are also many facilities and many services that are not subject to government's restrictions. However, please refrain from going to these and using these services and facilities. We ask the public to understand the ultimate aim of the social distancing measures, and as we did until now, I'm confident that we are able to overcome the virus spread. And the government will also exert our full efforts to enhance our medical capacity and quarantine capacity as well. First of all, the government will also trace any silent spreaders and any possible patients in the area by expanding the preemptive testings. First of all, as for those who visit these screening clinics, we instead of having the epidemiological investigations and testing and looking at their symptoms, we will enable them to get tested as well. And as for the people with who have symptoms who have visited pharmacies or clinics, we will also guide them directly to the screening clinics as well. And as for the metropolitan area, we also will enable easy and convenient testings for office workers as well as other members of the community, and we will extend the hours of the screening clinic to 9 p.m. During work days and 8 p.m. during the weekends. And we will also put in place the immediate antigen testings so that we can have more rapid testings as well. And as we see a rapid spread of the virus in the metropolitan area, please note that the virus can expose and can be exposed at any time, at any place. And if you have any suspicious symptoms, please visit the screening clinic as soon as possible. Meanwhile, we are seeing a continued rise in the number of cases, and we have a greater burden on the medical capacity, and we will also like to secure more medical capacity going forward. As for the life treatment centers for the mild to light symptom patients, we will also increase these numbers going forward. And as of yesterday, we had opened three additional service centers, the life treatment centers that is, and we have about 23 facilities and which can house about 4,800 patients, and the utility rate is at about 58%, and we have a room for about 2,000 more patients. And the utility rate in the Seoul metropolitan area stands at 60%, and this can house over 1,300 people. And going forward, we will also have more designated hospitals for the respiratory diseases and increase these hospital beds by 400. And currently, nationwide, we have seen that the utility rates of these hospitals and beds are about 65% nationwide and 75% in the metropolitan area. And going forward, we will secure more hospital beds going forward. And as for these confirmed cases, we have some cases where they have to wait at home before they are moved and admitted to the hospitals. However, we will make sure that we will not leave them at their homes for over 1 or 2 days. And as for the critically ill patients, we have 43 hospital beds that are available for the critically ill patients, and we will also going forward secure more hospital beds as well. And we will also designate more hospitals to treat the COVID-19, and we will convert these hospitals, and we will also cooperate with the highest level hospitals and to also secure more hospital beds. And we will also mobilize more personnel, medical personnel, and medical equipment to treat those with the severe or critical conditions. And currently, we have 177 hospital beds that are designated to treat critically ill patients. However, we will also by year-end increase this capacity to about 311. And in the metropolitan area, we have about 126 hospital beds for the critically ill patients. And by year-end, we will increase this capacity to about 215. And in order to ensure the efficient use of these hospital beds, we have also revamped it and eased the guidelines for self-isolation and discharging of the self-isolation. And we will also make sure that we do not have a major lack of hospital beds going forward for critically ill patients. And going forward, there are many facilities, including winter leisure activities like ski resorts or snow sleigh resorts. And we will also intensify our quarantine measures for these areas as well. And the quarantine authorities will also monitor the quarantine measures, and we have provided a detailed guidelines for these facilities. And as for these facilities, these winter sports facilities, we will also have in place place detailed restrictions on the number of users, and also they will also have to close down after 9 p.m. and starting from level 2.5, these indoor facilities need to also close as well. And as for outdoors facilities, we have to also limit the user capacity to about one-third, and also close it down after 9 p.m. When the level has been adjusted to level 2.5. And we also have detailed measures for each of these facilities. So going forward, we will work closely with the local governments to carry out detailed quarantine and monitoring. And as for the voluntary participation of the quarantine measures by the eateries, we will also make sure that we entail these and promote these participation. And we will also carry out meetings with the representatives, and we will also revamp needed guidelines, and these have been discussed already. And we will also make sure that we will expand the scope of these quarantine monitoring staff, so that we can intensify the quarantine measures and quarantine monitoring on site. And we will also make sure that these eateries have enough quarantine supplies like partitions or so forth. And we will also designate and name and provide incentives for those who have been picked as exemplary models. And please note that the life quarantine measures and social distancing measures is very important to be carried out on a daily basis. And it is also advised of the following. First, please also cancel all of the meetings or year-end Christmas holiday meetings and gatherings. I believe that it is very unfortunate. However, we need to postpone these meetings for the sake of the safety and health of all of you. And also please note that we should delay all of our meetings, and please also note that we have the following campaign that will be starring the golfer Park Se-ri, and please also take note of this, and we also extend our deepest gratitude to the golfer for her participation. And second, please refrain from going to crowded, confined, and close contact environment. In particular, if you have to visit restaurants when you are not consuming food, wear your masks at all times and keep social distancing measures. And while you are consuming food, please refrain from having dialogue with others. And third, it is very important that you comply with the personal hygiene measures, including wearing a face mask and washing of your hands. And please note that a single face mask is the most efficient measure to protect yourself from the virus. And last but not least, if you have any symptoms or if you are suspicious of the COVID-19, please get tested as soon as possible. We are seeing rapid spread of the asymptomatic patients in the young generation and middle-aged generations as well. So for the sake of your safety and to protect the lives of your loved ones and those around you, please get tested as soon as possible. And testing is very important to cut the chain transmissions. And as we stand at a very critical juncture, it is very important that you comply with these measures. We ask for your participation once again. And please stay home and also refrain from going to crowded, confined, and close contact environment. Wear your face mask and get tested as well. We ask for your proactive participation, and together with this, we will also exert our full efforts on the government level. Thank you very much.
That was the government briefing on the latest COVID-19 situation here in South Korea. It confirmed 686 new cases, of which 662 were locally transmitted and 24 cases were from overseas. With 4 additional deaths, the death toll now stands at 556. That does it for our coverage of the briefing. We'll be back at 12 p.m. Korea time with our midday news with Mark Broom. Bye for now.